Welcome to the Mom's Mental Oasis, the show that explores maternal mental health, motherhood, and parenting. We are all about nurturing, supporting, and educating because we know that when we know better, we tend to do better. I am your host, Nonny Mbathane, and it is a pleasure to have you with me here today. If you are new to my channel, I welcome you and I ask that you please sincerely subscribe. And if you've been here with me for a while, thank you so much. I truly appreciate you. Now, our episode is part of maternal mental health awareness, and the episode today focuses on this topic: when birth becomes trauma, understanding postpartum PTSD in mothers. So, not everybody has a beautiful childbirth, and that's okay. We don't predict childbirth at all, but it is very important for you to understand certain things that are happening to you and when to really start saying, okay, I think I might need help. So I have a special guest today. As you know, I like to bring people in when we're talking about very vital, important topics of motherhood. And she is an amazing woman that I've met through a doula. Guys, I'm bringing a lot of doulas this year. Like, we're bringing the house down. But thank you so much, Nonny, for being here. How are you?
I am very well. How are you?
I'm good. I usually let the guests introduce themselves because I feel like you guys give yourself so much in-depth. I'm just saying. Will you introduce yourself to our viewers?
Okay. I'm Nonny Mbathane, and I am a full spectrum doula. I just certified my full spectrum training after 18 months of studying and work and practicals. I am from Joburg, born and raised in Joburg. And I was living abroad for about 7 years. I've recently just come home, which I'm really excited about and still adjusting. My background is psychology, gender, childhoods, from an academic point of view. And yeah, I'm just a curious human being. Honestly, that's how I would best describe myself. I follow my curiosities and I'm just a curious person.
No, I love that a lot. But okay, so we're having an awareness, and I chose post-traumatic stress disorder. It's a very broad diagnosis, guys, by the way. It's not just something of one particular thing. But for the PTSD, with my awareness, I want to focus on childbirth trauma.
Okay.
So I think a lot of women will now go like, what could that possibly be? Specifically, what is a traumatic childbirth to someone for them to really understand it?
So I think, like, when we talk about birth trauma, firstly, we just understanding what does that even mean when you say birth trauma, right?
Yeah.
Like, we envision birth to be this beautiful, wonderful thing. So when we put these words next to each other, it just seems really bizarre. But I think, like, just an overview of what birth trauma is, it's really a traumatic experience that you're having through a child birthing experience, right? And we can look at it in two ways, physically and psychologically, right? And when we look at the physical aspect of birth trauma, when we're trying to make people understand what it means, really it's looking at, medical interventions that happen that you necessarily may not have wanted to happen.
Yes.
Lack of control with your childbirthing experience. Lack of support.
Yeah.
So when we look at the physical aspect of it, we're looking at, like, any injuries you could have sustained in the process of birthing.
Yeah.
Not only to you as the birthing person, but the child.
Yeah, because I think a lot of us, we've experienced childbirth and we've seen different things on the news, on our YouTube, on TikTok.
Yeah.
And we align it so much with, saying that, I feel like, this happened to me. But sometimes we tend to I don't want to use misdiagnose, that's more clinical, but we misinterpret things because there's so many different things that a woman could go through during childbirth and even after, like the baby blues and postpartum depression, because so many of them, they have so much interlinkedness in them. So how can a mom who's sitting there and be like, okay, I think I'm experiencing PTSD due to birth. What could be that interlink into her mind?
So let's let's draw back. I think as an educator, sometimes I want to make sure in the most simplest ways we understand this, right? Because sometimes the barrier is the fact that it's something higher educationally or higher resourcing of information. And it's this is very, we should make it so simple.
Yeah, I get you.
People understand what it is. So if we're thinking about birth trauma and looking at it with these two sort of antennas that are attached to it, both the physical and the psychological part.
Yeah.
So I mentioned the physical part around the sustained injuries, right?
Yes.
And when we think about the psychological part, we're thinking about the traumatic experience that you had, right? In this process of childbirth, and how the mental distress that you may have experienced in that process has the psychological effect. Now let's go to our baby blues
and postpartum.
Yeah. So I'm going to address baby blues first because it's the most simplest, direct, but usually misunderstood for postpartum depression.
That's
right?
true.
So when we look at, first of all, the word postpartum, because even as I am in hospital spaces like volunteering and just being around family and friends, the moment I mention this so-and-so is in postpartum, it's like the idea is that by just using that word, they think they're sad, like it's postpartum depression. People don't understand that the term postpartum means the period after birth, whatever happened with the birth, right? Whether the baby survived or not, or, those are valid things to take into mind, but just sort of debunking this misunderstanding around postpartum firstly, right? So that we normalize families, partners, society to always view a person with a child in constant postpartum.
Yeah.
Right?
Yeah.
Now when we go to baby blues usually will start immediately after you've given birth.
Yeah.
Up until 2 weeks.
Yeah.
They should not prolong to after 2 weeks.
Yeah.
Generally. Right?
No, that is the thing that people should understand about baby blues.
That,
There's a limit to it.
There's a limit to it. There's an end to it.
There is an end to it. Yeah, that's a more proper word.
And that's more being very restless, irritable, lack of sleep. And that's natural because you're processing an experience that has a very huge impact in your normal life and who you are as a person.
Very true.
I'm not a mother. I'm a childless doula, if you were to say. And I'm very proud of that. I don't necessarily see it as a hindrance.
Yeah.
But I think it's just important to understand that childbirth changes the life of someone in so many ways, right?
Can you preach?
So when we look at baby blues, we're basically just trying to say that there's no medical treatment here. We are recommending rest, support, that kind of stuff. So that's us with baby blues, right? And now when we look at PPD, which is postpartum depression, and then we look at postpartum PTSD, post-traumatic stress, right? Is that postpartum depression is a mental health condition, right?
Yes.
It is more, I think to make it easy, I always say postpartum depression, link mood in disturbance and loss of interest.
Yes.
As the descriptors
would say.
And then when we look at postpartum PTSD, now we're looking at the re-experiencing of trauma through a childbirth related experience.
Yeah.
Right?
Yes.
And we also need to understand PTSD is you're having a traumatic or difficult experience happen, right? And now things like cognitive behavioral therapy could help, talking to somebody.
Yes.
The eye movement, EMDR, right? The eye movement.
Yeah.
I forgot the two words. I know responsiveness. I forgot the D word. But those are sort of the ways we can treat postpartum PTSD.
Yeah. No, I like what you're saying because a lot of times I think what people don't understand is I remember when I was saying I wanted to do this, there's a difference between mental health and a mental illness. Because a mental illness, it means you've been diagnosed, you have been tested, and it's been shown that you are experiencing this. But your mental health is just a state of your well-being, your emotionalness and your physicalness, and how all of those are maintained even through stressful events.
Exactly.
But when you now enter into a mental illness, no matter what you do, it is affecting you to the point that you need proper medical interventions.
And to add on that, it's also another indicator for birthing people out there. If you've been diagnosed with depression, it's likely that after this type of experience, it could affect the way you're having your postpartum experience, right? So to really like factor that into consideration, and also a way of being a little bit more vigilant and supportive of the people around us, especially if we know that they've had mental health challenges. Because not that birth is stressful, it's difficult. It's not easy. It's
work.
It's work. It's labor.
Labor is work.
It's labor,
it's
right?
work. You can't even deny that it's work.
Labor is work.
No, it's work. You're right.
And so therefore, naturally, why wouldn't, if you had challenges with depression, why wouldn't necessarily that come again in this situation?
Maybe we can even highlight what are those signs or symptoms that moms can be like, even family members can see. Okay, we know that persistent sadness is it's like the given signs of
for postpartum depression.
But I like to explain to the moms when I'm doing a talk at the ANC that, take an example of this. When you're crying, you'll cry for a period, then you'll stop.
Yeah.
But you can't cry all the way. It's not normal. It's a sign that something is wrong. And maybe we could give people like those signs that they can look into and be like, I think I need to get you help, or I need to get the help.
Yeah. With postpartum PTSD, some of the symptoms that I would offer to look out for are things like flashbacks, nightmares, avoidance, emotional distress. I think like top of mind for me, those are like common things that come around PTSD. And there's one I'm forgetting, hypervigilance. That's a very important one. So hypervigilance.
Maybe you can explain a bit more for the moms to get there. They're like, what?
Hypervigilance is, I think the best way to explain this is to explain what trauma does to the brain. So trauma rewires and reshapes the way you process connection, identity, right? And safety. That's the most important part. So if you have a traumatic experience that really destabilizes your sense of safety, right? Which in a childbirthing experience,
that's the most vulnerable moment. Like, your life. It's very vulnerable.
Very vulnerable. So when you're having that type of experience, the hypervigilance would come out of that because you don't trust that there is safety available to you. So you feel that you need to be aware in order to control and manipulate situations in order to achieve as much safety as you possibly can. Right? And that happens across the board, not only in childbirth. We see that with kids who've had traumatic childhoods. You know, the idea of safety is so challenging for them. You know, because as a kid, you need safety. To feel like you're well. That you're well, right? So in a childbirthing experience, when you experience something that really shakes up your sense of safety and belonging and identity, it really keeps you hypervigilant. Like you're always, I guess in my way that I'd explain it, hypervigilance is like you're always waiting for the shoe to drop. You're always waiting to see, okay, what is going to happen. Also, you're hypervigilant in the sense of your senses are so heightened to everything, right? And it's very overwhelming to the body.
No, you know what? I was just thinking about what you just said about how, trauma itself can be different things, like people doing interventions without your consent. And I think what is currently happening is we see more news on trauma coming from public. We definitely do. We know. But there's so many. What I do want to put out there is there's so many other factors in public health that people don't realize it's sort of a way, and I hate to say this, but it's sort of a way of people of abusing their power, because the power is abusing them in the system itself.
Absolutely.
But also, sometimes people think just because I'm in public, no, I'm in private, I won't experience trauma. But I like how you pointed out that being given an intervention without your consent or proper education about it, it's also trauma, because that's not what you wanted in the beginning.
And it destabilizes your safety.
It destabilizes your safety. And I feel like, we can touch into what mothers face, maybe examples of things that could face that can be an indication of a trauma. Remember, guys, this is educational purpose. This is not diagnosing of people. This is just to, I always say that when you know better, you really do tend to do better. So moms have this belief, oh no, trauma, because there are other moms who deliver in public and have a great experience.
Yeah.
Like, can there not be, let's not even deny that.
Absolutely. Yeah.
But there are also other moms who go to private and have horrible experience.
Yeah.
Maybe let's touch onto that. Let's get moms more aware of those situations that can happen for both private and public. But I definitely like that you pointed out that moms getting interventions that they didn't approve or consent on. It's a traumatic experience.
Very.
Maybe we could put on to other things more moms can experience that can be trauma.
I think there's always this debate about public health, private health, and I had explained to you as well that even in my studies, like around psych and has really been around, like, we cannot see these things as individual instances.
Definitely.
They're so complex and so nuanced. And like you're saying, you could see how experiences of trauma can happen through childbirth and public health.
Yes.
Because of various things that you and I and society know.
Yes,
right?
the factors.
And there are many structural, socioeconomical.
Yes.
Right?
Yeah.
But then also like mental attitudes of public anything.
Yeah.
Right? Just the mental attitudes we have towards them. Right?
Yeah.
And then when we look at private, like you're saying, there's some people who have really tough experiences in private. And I think for me to give my views, I guess, on both, even though I am mainly exposed to public birthing experiences through my work, I would say that for any of these things, I think that there's no way for us to necessarily say, if you do this, you will not experience trauma.
Yeah.
But we can talk about some of the blind spots that create these traumatic experiences that we don't take into account, you know? And when we think about private health, for example, right? Yes, there may be more people around you and giving you a little bit more attention, but we know that that is directly linked to the structural capacity of private care, right? Whereas we know that in public care, structurally, that's a hindrance for them.
It is.
Due to an overcrowding and low capacity of staff, right?
Correct.
And then when we look at private care, I could be getting undressed in my room or in my very small space. There's a level of privacy, right? And self-efficacy that public doesn't necessarily always afford you. However, there have been experiences of wonderful public births, right?
That's
but
true.
we need to factor these things into what are the situations and what are the factors that can make it susceptible for someone to have a traumatic birth experience. We can look at like public health, not necessarily always making it okay to bring a birth companion in.
Yeah, those kind of limitations of things.
Limitations, and then be like, well, in private care, I
can bring my husband. Right? Yeah.
But does it mean if your husband is there or your partner is there,
you won't experience a trauma?
Yeah. What makes you think that? Because also the idea is that we need to think of trauma not as this overtly violent thing. It can be very subtle and quiet.
Yeah,
right?
yeah.
In not communicating, no continuous consent.
Just doing.
And when you don't feel empowered, if your partner doesn't feel empowered and feels like, I don't even know what's going on here, right?
I'm just here.
If it's a heterosexual setup,
Understood.
right?
Yeah, I get you.
Then how do you know that they would advocate for you or support you in advocating for yourself in private care? So I think it's just about understanding that these things are not happening in isolation.
No, but you're right, because it's like that thing. It's a privilege because it hasn't happened to you, but in reality it has, just that you never noticed that it's happening. But you know, most mom will always say that I don't want to go back again. That was just an experience I never want to do anymore. And I feel like those kind of words themselves indicates to me that you've experienced a traumatic thing, but you have not gotten to that level where you realize, oh, that is traumatic experience.
Yeah.
But now when we look at how, PTSD for birth trauma affects the relationship between the mom and the baby, how can the mom start processing that so that they can fix their bonding with their child? Because that's one of the most, I guess, the best feeling after birth. Sometimes people are like, you forget. Just that you don't realize you forget, but you forget. Is the moment the baby lies on you, that instant skin to skin touch is the initial bonding. It might not feel like bonding, but it is the initial bonding. So let's talk to the moms that need to process it and fixed. I don't like the word fixed, but let's say adjust to those changes that the mind has experienced.
I think, so we're talking about it from a PTSD, not a depression.
For PTSD.
PTSD. So I think with PTSD, when we look at also what it is, right? We just to backtrack that we said that it's a traumatic or difficult experience, right? Normally traumatic experience that is related to childbirth, right? And how that would affect the bonding of the mother to child or birthing person to child is in a lot of ways, right? Like for the child, nutrition, right?
Yes.
Bonding, the natural bonding that they need. And I just want to go back a little bit to kind of support the things that moms could even think about in terms of alleviating some of those barriers and challenges around their connection and bonding because of the PTSD, is that because of that reshaping and rewiring that happens in our minds, it puts us in this fight or flight or freeze mode, right?
Hallelujah.
That anxiety, right? And then by virtue of that, that way of operating can affect the baby and a mom in a lot of ways, and the ways that we know is bonding. But again, I just want to bring it back to the fact that if I'm in a flight, fight, or freeze state of being because of the PTSD, there are things that are out of my control that by virtue of them being out of control affect that safety thing that we were talking about, right? That trauma reshapes the way you process safety, connection, and identity, right?
Very much true.
So then now what happens is you are responding, you're having challenges with bonding because there's a rigidity to maybe how you want to feed. And we know that we should feed upon demand, right? We can express on a schedule,
but we feed
and pump, but we need to feed on demand, right?
That's true.
There's no right or wrong way, right? And especially if then mom is chest feeding, that affects a lot. So this is not only affecting you and the way you're parenting and the rigidity you've kind of forced yourself into to create some normalcy and sense of control and routine.
Yes, true.
To counter the destabilization that PTSD has done to you, so it affects nutrition, it affects feeding, and also we require our bodies to be at a natural calm state in order for natural bonding to happen. I can't bond with you if I'm incredibly anxious
all the time,
right? So it causes that barrier.
No, you're right, because I always tell the moms that the baby feels what you're feeling.
In the same way we feel what we are feeling around other people.
Exactly.
As an adult, like I can feel if this person,
you see,
there's nothing wrong with them. It's just like something doesn't feel right.
Just doesn't feel right. And now it gets to the point of how does she then? Because I completely understand how a traumatic birth experience can make you really not want, because especially one that is like life-threatening, where you almost lost your life. You have this thing of looking at your child and we're like, I almost died.
And
Like,
the child is linked to that
it's
traumatic
linked to that
experience.
traumatic. How can they reclaim that back? How can you reclaim your, like yourself in that process? Because another thing, people should always understand that there's this huge identity shift when you're a mom. And now you haven't processed it because there's a trauma that's blocking that. How can she claim it back?
I would say because the process of healing from trauma is not linear. It's personal, right?
Very true.
To really think about it in the sense that there is no timeline to when I need to be okay or over this, right? Because then it doesn't hold you hostage of allowing yourself to process and release things, because then you don't feel like you are co-signing the bad behavior or the traumatic experience.
Thank you right there.
So it's about just knowing that you just need to be patient with yourself and claim that it's your process, and the people around you need to respect that and hold space for that and not rush you or even feel that they have the right to tell you how you should be processing it.
Yeah.
You know, that like you should be grateful, your child is fine, you are fine, you're here. You know, it's like, oh yeah, I'm not.
It's like a grieving process.
You're grieving because you're grieving what you thought was going to happen and you are grieving what you wanted to happen, right?
Yeah.
And you're grieving what didn't happen, right?
And it's okay.
It's fine.
Like, no, like you're right, because it's scary. Like, I think my second one, I had it's not PTSD, but I had a traumatic experience.
Yeah.
And to the point, like, I fear death. I never feared. Okay, I'm not saying I don't fear death. Okay, that sounds so wrong. But it can happen. And the realization of that has made me go like, I don't want another one.
No more.
No more.
Yeah.
But when you acknowledge it, it's claiming it. You're saying, I did go through this. And that's your step of getting your confidence back.
Yeah, and I think also just like people choose, and I think people should be open to choose their own healing modalities. Not everyone works with cognitive behavioral therapy talking. Not everybody wants to go on medication, and maybe if they don't need to. I'm not saying if your psychiatrist is saying you need to for the purpose of your
I
well-being,
understand. Yeah.
You know, but what I'm saying is that there's so many healing modalities. There's somatic practices.
Hello.
There's,
Preach it on.
So I think it's just also that to empower mothers and birthing people to say there are different healing modalities and you have every right to do all, tap into a few, figure out, maybe somatic might be easier once you've spoken.
Yeah.
Do you understand? Because the somatic is the part of moving the feeling throughout your body.
Yes, true.
You know what I mean?
Yeah.
So I think it's things like that to bear into mind, that if you don't have language for what you're going through, it's incredibly confusing and isolating. So to really be curious about, well, what can I do? Who can I? And I know it's not easy. I know. I absolutely know that this is easier said than done.
Yeah.
But I think more important is about empowering yourself, owning it, and being open to the many ways this can be healed and not let other people tell you how it can be.
No, I love that you pointed out that there's so many ways to heal.
Yeah.
You don't have to take one route. You can explore as many as you can, and
with safety, of course. Yeah.
Of course, very much. But so many of us have always believed that one way is the way. Yeah. And that's the thing about mental health. There's so many ways to lead into that one point. All right. I felt like I usually spend the whole day with me. But, I want to close with these two things first. What do you think storytelling and sharing experience, what role does it play in healing?
Oh, across the board, I think that one thing storytelling does, whether you are actively part of the storytelling process or you are a person taking in the story, it shows you that these experiences and the emotions we feel around them are not in isolation to ourselves. And I think once you get that, you're like, oh, okay, there are other people who know this or understand this, right? Whether it be a death of a parent, death of a child, loss of a spouse, a friend, I think once we understand that there's an interconnectedness, then storytelling provides a mirror to be able to see yourself, to be seen by others.
Yeah.
And I think that storytelling in and itself, for me, amongst many beautiful things that storytelling provides us, different perspective, vantage points, same experience, different perspectives, but more than anything for me, because it's for the purpose of healing, it shows us that like we're never alone.
There's a point of reference.
We're never alone. Things are interconnected.
All right, now, for any mom listening right now and silently struggling after her birth experience, what would you want her to know?
You did nothing wrong.
Yeah.
Because there's a lot of shame and guilt that mothers can impose on themselves after difficult experiences.
Yeah.
So I think more than anything is to let you know you did nothing wrong and you have the right to ask for help. And I think also to listen to their bodies around the spaces that they share. I'm very big on like, you don't just get to hear my stories and my difficulties. You have to earn some level of emotional safety with me, So I think just to say like, you don't have to tell your cousin, even though your cousin's like, but we're friends, like we're cool.
Be picky with who you let in.
Yeah.
Because it's a vulnerable moment for you.
So I think like it's okay, listen to yourself, in the sense of, I don't like saying it's okay, actually. It's a term I never want to even hear in a birth space, because it's like, I'm not okay. And you're telling me it's okay, So I think honestly, to boil down to the fact that like you did nothing wrong, you have a birthright as a mother to ask for help. As a human being, you have a right to ask for help. And I think also to know that these experiences are transient. They will move, and the way you feel about the experience of your child and the birthing process, however the outcome is, will shift and change and be malleable, be open to the ways that it can shift and change for you. And not to hold yourself hostage of the feelings that you're processing as you're going along, because it's important.
Thank you.
Moms are big deals.
It's like you're talking to me. Thank you so much, Nonny.
You're always welcome.
Guys, I hope this was very educational for you as it was for me. And we'll